everyone. Welcome to the Preemie Chat. Preemie Chat is our weekly educational sessions for healthcare professionals and parents to talk about what matters to you, to explore new ideas, and to learn together. I'm Fabiana Bacchini. I am a Preemie parent and Executive Director of the Canadian Premature Babies Foundation, as known as CPBF, and I'm happy to be your host today. CPBF is a parent-led charitable organization that helps families in and after the NICU through support, education, and advocacy. If you have a heart for preemies, whether you are a family or a healthcare professional, please check our website at canadianpreemies.org. There you'll find resources, the latest projects, and most importantly, a community of people who wants to see our little babies thrive. If you're watching this session live today, please bring your voice to this table, leave comments and questions in the chat, and you try to address them during our program. It is through rich conversations like this that we can advance practice and learn together. So please participate and let us know where you're watching from. And today is not Friday, where is the day that is usually our Preemie Chat. We are having a special session today to address protecting your baby, your term baby or preterm baby during this holiday season. The holidays, we know as preemie parents, it can be especially stressful if you have a preemie baby due to heightened health concerns and social pressures. Preemies often have underdeveloped immune systems, making them vulnerable to infections like RSV and influenza, which are more common during family gatherings and social events. Parents might feel anxious about enforcing boundaries, such as ensuring proper hand hygiene, limiting physical contact, which can lead to tension with loved ones. The disruption of routines reduce access to medical care during the holidays, and financial strain add to their stress. Emotionally, the season might trigger memories of time spent in the ICU or feelings of grief for families who have experienced loss. While the need to balance holiday traditions for older children can further complicate matters. So despite these challenges, parents often prioritize their preterm baby's health over societal expectations, leaning on support networks or adapting celebrations to create safe and meaningful experiences. And you have here Marianne Bracht, who will explain why preemies are more vulnerable and how you can lower your baby's risk of getting sick. So I'm going to bring Marianne here. She's joining us live from Toronto, and Marianne has 43 years of nursing experience in neonatology. She was the RSV nurse coordinator in the ICU at Mount Sinai Hospital in Toronto, and through her career, she advocated for parents, provided education, and supported. She created and co-led parent education programs and participated in international research on family integrated care. Since her retirement, she is the project coordinator for an ongoing research pilot looking at improving the transition of families and infants to home and the community. She's also the chair of CPBF's Education Committee. Marianne, welcome.
Thank you, Fabiana. I am so pleased to be here. And hi, everybody. I'm really happy to be here to share a little bit about what Fabiana's talked about. And I think, Fabiana, you captured it really well. It is always a worry for every family at this time of year. So I'm going to share a little bit about why babies are at risk, why preemies are a little bit more at risk, but we can decrease the risk and we can have fun with our babies as well. And
Absolutely.
I really want you to be at the end of this season, the end of this presentation, and throughout the season, loving your babies, having a good time with your babies, and understanding why they're at risk and how you can decrease it. So thank you.
Marianne, just remind everyone watching us, please do send your questions and comments at the end of Marianne's presentation. We will have a time for Q&A. Thank you, Marianne. The floor is yours.
Thank you. Yes, no, this is going to be a short presentation to allow families to have a discussion and bring up the questions or the anxiety that you have at the end of this. But what I want to start with is maternal antibodies. And I'm sure a lot of you have heard those words before, and they're extremely important because they provide newborn babies with some protection. These antibodies are transferred through the placenta throughout the pregnancy, but mostly in the last few weeks. So if you look at the bottom here, at this little diagram I have here, you can see the antibody levels at gestational ages and at term. So if a baby is born less than 28 weeks gestation, let's say 24 weeks, 27 weeks, they only receive about 18% of the maternal antibodies. Babies even 31 weeks and less only receive 30%. But the interesting thing is our babies that are born less than 36 weeks gestation, they still don't receive a lot of maternal antibodies. So it's the full-term babies that do get all the antibodies, but I'm going to share with you why they become a little bit more vulnerable throughout the first few months of their lives. And Fabiana mentioned preterm babies have an immature immune system, and that's purely because they were born early. So I talked about the antibodies and the importance of antibodies. And if you look here at the green dotted line or the yellow and the blue one, what they are showing you is the antibody levels of the babies when they're born. So the full-term baby gets the full complement of the maternal antibody, and the preterm babies do not. But what happens to all the babies, the maternal antibodies start to become absorbed. Right down here, babies start to make their own. So the most vulnerable time for babies, even the full-term babies, is literally in the first 7 months, even up to a year. So the antibodies start to grow, develop rather, or build up. And the babies less than 36 weeks, their antibody levels are sort of in between in the middle here. So as mentioned, all newborn babies at least less than 7 months of age, are vulnerable to getting a little bit sicker if they got a respiratory infection. Okay, so for the babies that were born preterm, they also have the immature airways. And I would like you to look here at this diagram I have at the bottom. By the way, all these diagrams that I'm going to be showing you going forward are all on the CPPF website. But if you look here at the bottom here, to the left-hand side, a little premature baby's lungs. So you have your airways, okay, and they go right into the lung, and then these little purple dots. These little purple dots are called air sacs. The full-term baby, on the other hand, they have their airways, okay, and then they have all these little dotted air sacs. They're also called alveoli. So if you look up at this diagram up here, these are the air sacs at the end of the airway, okay? And this is where the exchange of gases take place. So a baby, or we breathe in, the air, the oxygen comes down these little pipes, goes to the alveoli here, or the air sacs around the body, and comes back up again. So the full-term baby, when they're born, they got their full complement. So therefore, it's easier for a baby that's born full-term to breathe. For the premature baby, on the other hand, that's very different. And many very premature babies have to have some respiratory support. Some may be intubated, they may be on CPAP or receive oxygen. One of the things about lungs, the good news about lungs, that lungs continue to develop until babies or children are at least 8 or 9 years of age. So this is in the first year that we're talking about, okay? But lungs do develop, and they develop well. So the other thing that happens to babies who have been born really early and maybe being intubated or a long-term CPAP, they could end up with something called chronic lung disease or BPD. And I think for those of you whose babies may have that diagnosis, you know what that might be. So here we go with respiratory infections. RSV, many of you know, is the most common respiratory virus. It can become more than a cold. And what happens is it can cause a lower respiratory tract infection, hospitalization, and possibly lifetime complications. The interesting thing about RSV is if you have one RSV infection, it doesn't protect you for another RSV infection. So babies, adults, we can have 1, 2, or 3 RSV infections during the winter. It's the highest number of hospitalizations with an RSV infection, and all infants are vulnerable, as I explained to you or showed you on that graph, in terms of the antibodies being decreased as the babies start to build their own. Highest risk, babies less than 3 months of age, babies born less than 35 weeks gestation, babies who were given a diagnosis of bronchopulmonary dysplasia, some congenital heart disease, and this is not the PDA that some of you may have heard that your baby had a patent ductus. That is an immaturity of the cardiac area, and that does not relate to heart disease. And there are also some special diagnoses which is determined by different provinces and territories. So as mentioned, this is an infographic here on the side, and it's available on the CPPF website, and it goes into more detail than what I've given you now. So this is interesting, and here's a graph of an average yearly reported viruses, various viruses. So it's the flu virus, coronavirus, RSV, etc. The yellow bars are the RSV. And what they look at when they're actually reporting the viruses, they go from the end of September to the end of summer. So they do a year so we can look at how these viruses or the positivity of viruses in the winter months. So the yellow bar, as I mentioned, is RSV, and you can see there's way more RSV out in the community than there is of the other viruses. But RSV is around all year. You may be able to see a little bit of it here. Okay, so although we need to be concerned about the winter, there's still some RSV that floats around throughout the year in the summer months as well. So what does RSV look like? Well, an RSV cold looks very much like other cold viruses. And the only way you might know that a baby has RSV or even an adult has RSV if swabs are done in the emergency department. So call your doctor if you're concerned. Always call the doctor. But all these viruses may show as a cough, a runny nose, maybe a little bit of fever, possibly a little bit of a wheeze. When you don't feel very well, you don't eat. And of course, if you don't eat, you don't feel very well, you have decreased energy, you don't feel like doing much, very much like us as adults. Again, on the website is an infographic here, and it identifies what I just talked about, and it's available on the CPPF website, and it's in 19 languages. The last two was Urdu, I think, and Cree that was just added. As mentioned, RSV cold can lead to bronchiolitis or pneumonia, and that is what we worry about. And what that is congestion in the small airways. And if you look here to the right of the screen here, we have a little piece of an airway. And to the one side here, we have a totally open and patent airway. Okay, a healthy airway, baby can breathe in, can breathe out. But if they got bronchiolitis or pneumonia, what happens is there's inflammation along the sides there of the airway, and in the middle is the infection. And what happens with that is it's very difficult to breathe. And in the very, very young babies, they could end up with some apnea or pauses in breathing, and that is quite a big concern. So you will see deeper and more frequent coughing. You may see blue lips or fingernails because the babies aren't getting enough oxygen into their system. And of course, as mentioned, if you're not eating, then you become dehydrated. Any signs like this, any difficulty with breathing, you must call 911. I don't recommend babies being taken to the emergency department for this, because putting a baby into a car seat is obviously going to make them worse. So please, if your babies are ill, you must call 911. So we all know how viruses are spread. We talk about it a lot. We talk about our hands. But if you look here to the one side with that person coughing, they cough and it goes out about 3-4 feet. And if you're standing in the area and they have RSV or other viruses, those viruses can go in through your eyes, through your nose, or through your mouth. But if you're not around and that virus lands on a tabletop, on your cell phone, and you didn't see anybody cough, and you pick up your cell phone, you may have picked up the virus that landed on that from somebody's cough. And then, of course, what do? We touch our face. We touch our glasses, we touch our hair. It's very common for us just to touch our faces. But viruses can remain infectious for several hours on hard surfaces. So I'm going to show you what that means. So as mentioned, if somebody is sick with RSV, they've coughed, they've touched their face, they touch a countertop, that virus can sit on that area, in that area on a book, any hard surfaces for up to 7 hours. It can also sit on the skin. So you cough into your hands, you don't wash your hands, and that virus can sit there for 30 minutes. And then we also talk about cloth. And I know we're told to cough into our sleeve, but it's important to cough into our sleeve like this rather than up here by our shoulder. Because if we are sick and we go to burp our babies' faces is right up against that cloth. And that virus can sit there for about up to an hour. Paper tissue, again, 1 hour, you blow your nose, you put the tissue in your pocket, you touch that tissue again, and that virus is still there. Gloves are interesting because, yes, they protect our hands, but the virus can sit on the gloves for up to 2 hours. So if you're putting on gloves, whatever you touch, if it has a virus on it, or RSV virus specifically, that will sit there for up to 2 hours. So let's talk about hand washing. The most important hand washing is done with soap and water. Okay, and I know hands can get sore, so it's impossible to pat your hands dry. Don't rub them dry because especially in the winter months, we can get very sore hands. But if soap and water are not available, hand sanitizer is next, but please check that there's at least 60% alcohol in the hand sanitizer, because there are a lot of them out there with lovely smells and pretty bottles, but they don't have enough alcohol in it to protect your hands. Avoid touching your eyes, nose, and mouth with unwashed hands, and that's really hard to do. Even I have difficulty because I'm always pushing up my glasses. Parents in the past used to ask me about a mask. The thing about a mask is that after 20 minutes, your mask becomes a dirty Kleenex. So people don't think about that, and they may touch that mask, move it up on their face because it's sliding down. And what happens is if you're sick and there's a virus on it, again, you're passing that on. So although a mask might or might not be a good idea, be very careful about touching it and how you dispose of it. So RSV prophylaxis, RSVP, many of you probably have heard of those initials. It is a protective antibody injection. It is not a flu shot or a vaccine. The important message here is it decreases the risk of hospitalization, but it does not decrease the risk of an RSV cold. Decreasing the RSV cold is the hand washing piece. Provincial and territorial guidelines differ across Canada as to which groups of babies they feel is important to get this antibody injection. And some of you may know that new this year is something called nirsevimab, given in Ontario, Quebec, and Nunavut. Okay, so in Ontario, all babies born during 2024 will receive this protective injection. So a full-term baby born in February or a premature baby born in January, it doesn't matter. Every single baby born this year in Ontario will be protected or should be protected. In Quebec, all babies born on or after April the 2nd qualify to receive this protective injection. The rest of Canada, the babies are still receiving palivizumab, and it will be their same provincial or territorial schedule and criteria as they've all had in the past. And this is only for babies who are born premature, and depends on the gestational age and the province. CPPF provides information and links to all the provincial and territorial, the criteria on their website. So you can have a look to see what province you live in and go and have a look and see, or speak to your family doctor. Okay, as mentioned, nirsevimab is new this year. Palivizumab has been around for 24 years. Both of them are an antibody injection. And if your baby is receiving nirsevimab, it will be given before the season or during the season. If your baby's receiving palivizumab, it will also be given before the season or during the season. This depends on when the baby was born. If the babies are in the NICU, then that discussion will occur in the NICU. And remember, it's Ontario and Quebec and Nunavut that are giving nirsevimab this year. Okay, palivizumab is the other provinces and territories for 2024. Nirsevimab is one injection, and it's given, I said, at the beginning of the winter if the baby was born during 2024, or it'll be given during the winter if the baby is born in the next few months. And it protects a baby for up to 6 months. Palivizumab, on the other hand, is given for a monthly injection during the winter. So if the baby's born at the beginning of the winter, the baby possibly will give 4 or 5 injections. And if the baby is born in the middle of the winter, it depends on when the RSV season finishes. And the RSV seasons finish differently across Canada. And again, this is a discussion and information through either your public health department or through your doctor or the NICU. These injections are given in the NICU. They can be given in the doctor's office if the baby's at home, or an RSV clinic if the baby's at home. Again, ask questions in the NICU, the baby's doctor, or the CPPF website, because it has an incredible amount of information. It also has an infographic on the differences between the two, palivizumab and nirsevimab, and more than what I've given you just now. Okay, so Fabiana had a really, really good introduction about the anxiety that families have. And I know I worked in the NICU for many, many years, and I saw a lot of anxiety, worry. Your baby's in the NICU, your baby's been sick, you've had a lot of information given to you. It's hard. And postpartum depression is higher in mothers as well as fathers. It's really, really important for you to share your story with family and friends so they understand why you feel so anxious. But I do know, again, from my experience, that families had a lot of difficulty sharing their story. They didn't want to relive what happened in the NICU, yet they're fearful. CPPF has a letter for parents to adapt and to share. It talks a lot about your baby going home and what the concerns are, etc. So please have a look. It's also on the website. So what's so difficult about going home in the winter? Well, I took a full-term baby home in the winter, and it was dark, it was cold, I was isolated, and yet I didn't have the same worries that you may have having had a baby in the NICU. And of course, we've also gone through having COVID for the last few years, so that's been an added concern as well. I think the biggest fear that parents have is that their baby is going to be readmitted to hospital for anything, not just a respiratory infection, but a worry about anything and everything. The other thing is that many families have other children at home, maybe in daycare, maybe in grade 1. And we know what daycare is, and we know the infections and the viruses. You may also have family members living with you, grandparents, other children. So these are things to think about, and I'm going to talk a little bit about how to decrease that risk. And the other thing is holiday celebrations. Fabiana talked about it because quite often families will say it's really important for babies to be exposed to infections because they'll build up their immune system. It's not true. If you go back to that graph and you go back to babies at the birth and the amount of antibodies they have in their system and how those antibodies get absorbed and how they start to build their own, they need to build them. They need to start building them and they need to be protected. So it's really important for families to understand that so they can support you as you're going through the winter months and holiday celebrations. So we're going to have some time now to have some discussion about this, but here are the key messages that I feel are important for you to consider and think about. Hand washing. In your home, you can't always be washing your hands every time you pick up your baby. It's not realistic. You'll end up with dry, sore hands. But if anyone is sick in the home, I suggest that you hand wash when you pick up your baby. And I also suggest moms and dads, or moms or the parents, the responsible person for that baby, be the only one to care for that baby whilst other siblings are sick, if you're able to do that. The other thing I would say, try and avoid crowds and malls. If you do need to go out shopping, it's really important, and you do need to go food shopping, it's realistic, then go out of rush times. No kissing the baby if anybody's sick, and especially if mom or the parent, make sure that you don't kiss your baby. And of course, avoid cigarette smoke. It's funny, my daughter had a full-term baby in July, and we had an event on Sunday. And here were my suggestions to her. There were a lot of people in the room, and I suggested that she have or designate 2 people to hold her son, not to pass the baby around. I do know that people want to hold the baby. I know people want to be excited about the baby. But when you take a baby out to any event, it's important to go, but it's important to consider once you're there, who is this event for? And what I'm trying to say here is that people want to hold the baby, and passing the baby around to 4, 5, 6 people, that doesn't benefit the baby at all. It benefits family members or friends. So I recommend that you try as much as possible not to pass the baby around, because the baby finds it irritating over and above getting sick. Very importantly, going outside does not make a baby sick. Sick people do. So it's important to go out, to go for walks, walk around the block, maybe even visit a friend, maybe visit a family. Just ensure that they're healthy. And if they have young children at home that are in daycare, I would maybe suggest staying away from that during the winter months. But again, you need to assess what might work or how this is going to work for you. Keep your baby's vaccinations up to date. Premature babies' vaccination schedule goes according to the day they were born. So if your baby was born in September, the first injection, the immunization will be, or their vaccinations will be September, October, November. So vaccinations are given according to the date the baby was born. It is important that parents and other siblings' vaccinations are up to date. You do not want your baby full term, and especially preterm, to get whooping cough. And I know that measles is going around. There's a lot of infectious diseases going around. The immune system of babies is very different to that of a 5-year-old or a 20-year-old or an adult. It's important for parents and siblings to have their flu shots and COVID shots up to date. Babies cannot have a flu shot until they are over 6 months of age. Okay, so a newborn baby has to be older than 6 months of age. It's important to talk to your baby's doctor about this and to get questions answered. And again, on the side of this presentation here, there's a whole thing about immunizations, and that's an infographic again on the Canadian Premature Babies Foundation. Lastly, but most importantly, take care of yourself. But what does that mean? And I think what I'd like to do is bring that up to Fabiana, because I remember when Gabe went home, and I remember saying the same thing to you. And I remember you saying to me, but how can I? And I remember you saying, I'm really worried. I don't want him to go back to hospital. And I would like you to start that conversation, but I'm going to go to this first. The parent booklet, Reducing the Risk. It is an amazing booklet on the CPBF website. It talks about all different viruses, and it talks about how to reduce the risk. But most importantly, please remember, going outside does not make your baby sick. Love your baby, kiss your baby, have fun with your baby. Do lots of good, fun things with your baby. And those are my 2 take-home messages. So Fabiana, maybe you would like to share a little bit about taking Gabe home, or what you know, what parents have told you, or if there are any questions online that people would like answered.
Thank you, Marianne. I always learn something new with you every time you present this information. And yes, you just brought me back 12 years ago, because I brought Gabriel home. It was October, beginning of RSV and flu season. And he did come home on oxygen. And I did have my 3-year-old son in daycare. So I was absolutely terrified of Gabriel getting sick and back to the hospital. Which unfortunately did happen. As you know, a month and a half later, my older son came home with a cold, and Gabriel, we tried everything. Gabriel still got sick, got readmitted to hospital with pneumonia, and we spent another couple of weeks in the hospital. And it was very, very hard for us to be back in the hospital, and very worried about his long-term consequence of having a respiratory infection. I did lock my house for a year. I didn't have anybody coming to the house. But today, when I look back, I don't think I did any good for me personally, because I was very isolated. It was a very, very difficult year trying to make sense of my journey in the ICU, and being really isolated. I think today I would have done things a little bit differently. I would have gone for the walk. I would have met a friend at a coffee shop outside. I would have done few different things that I haven't done, that I didn't do back then, that I would have done today. One thing that families always tell us now, I've been doing this work for 11 years now, supporting families in the community. It is always a worry that the child's going to be readmitted in hospital, and how parents find a balance between having an older child or managing family's expectation versus protecting this vulnerable baby. So it is very hard. And I think you covered pretty much everything that the families always ask us. But I want to go to the chat because we do have an important comment here that I think we have to address, because you mentioned, Marianne, when to call the doctor versus when to call 911 in Ontario. We know some different areas have a different emergency number, because you said call emergency or 911 instead of putting your baby on a car seat and take the baby to the hospital. Can you tell the difference when you call 911? It is an emergency and the baby needs immediate attention versus driving half an hour to the hospital. Talk a little bit about that.
Yes. The ambulance might put the baby in a car seat. They might strap the baby to a stretcher. But there's a couple of things here. One is you may not put your baby in safely. Secondly, you may be in a car accident because you're so anxious. Thirdly, the ambulance do have paramedics, and they have all the equipment necessary to ensure that the baby's airways stay open, or that if the baby gets into more difficulty breathing, that they can do something about it. So it's really, really unsafe. Now, on the other hand, if your baby has a bit of a cough and not feeding very well, and you want to take your baby to the emergency department or to your family doctor, or call your family doctor first, that may be a little differently. But as soon as parents start to get anxious about it, the safety part goes up quite significantly. So have I answered your question, Tina?
I hope, Tina, if you're still with us, please, you can comment. Yes, but I think the big concern is that if the baby's turning gray or blue, it is an immediate attention from, and paramedics can provide that. So you don't want parents to be performing CPR in their own home or and take actions later. I think that is, I think, a big concern for parents if, if the baby is very ill.
Well, I'm going to interrupt you. You brought up a good point, which I didn't address, and maybe I should, is CPR. I highly recommend that every parent takes a CPR course or a first aid course, because if the baby does stop breathing, if a baby does stop breathing in the home, and it can happen to any baby, they could choke and have nothing to do with RSV. It's really, really important for you to be able to do something safely. And Fabiana, you can talk about it if you want. That you can do it safely until the paramedics come, because putting your baby into a car seat will make it worse. I would prefer that you took a course.
Yes, well, I did have to do CPR on my son once, and it was a very scary situation that I certainly, why I'm still grateful that I had the skills that you taught me how to do CPR. I wish I had never needed to perform that CPR, but I had the skills. But obviously, I had also people coming to rescue Gabriel right away, because you're in a medical facility back then. But it is, I think, it's so important to know what to do. Not as you mentioned, not only because of breathing, but also because of choking, because these things happen in the house, and we need to know what to do. Marianne, let's address a little bit about mental health of parents, because we know how hard it is during the holidays for parents. And when can parents identify the normal kind of worry, the anxiety they have, versus when parents say, okay, I cannot cope with my anxiety, when it's time to look for help because the anxiety is so severe, versus like a normal kind of anxiety, considering that we are preemie parents, that we did spend time in the ICU with our babies, and saw our babies going through so many procedures. But we need to understand when we need help. And I think this is something that we don't talk about enough, because we do have PTSD, we do have anxiety. We hear a lot of parents, they stay in the baby's room watching babies breathing overnight. It is real, right? Like, so when is it too much?
What you did was too much, staying home for 1 year. No, this is really, really serious. You know what, even having had a full-term baby, I was anxious about some things as well. But it's when you can't do anything. It's when you can't, you're not eating properly. You're not sleeping properly. You can't go out. You're not enjoying your baby. You're not having fun. And I get going home in the first few weeks. It's really hard to you had monitors in the hospital. You had nurses in the hospital. That is a really, really, really big transition. And that's tough. But if you can't get beyond that transition, and you aren't sleeping, or you're not going out, or with your partner, you can't talk to each other about it, or one is less anxious, the other one is more anxious. And so you start to have disagreements about things. It's really, really important to talk to the doctor about it and try to work through whether the anxiety is normal amount of anxiety, is my baby breathing? Do you go into the room once or twice an hour to check when the baby first goes home? Or are you still going in when the baby is 6-7 months old? You're worried the baby isn't eating enough, and you're pushing the baby to eat, or you're worried about somebody has a little bit of a cough and you start to get upset and start crying, or if you're crying more, or some of these things are they have to start getting less in the weeks following a discharge.
So always be aware of how you're feeling, how you're behaving. This is your message, basically.
Well, it is. I mean, let's say it's a cold day today, but you say to yourself, it's a windy day. It's not a very pleasant day out here in Toronto. And you say, well, I can't go out. My baby, I can't do it. I can't. Well, you can. You can go out if your baby is well dressed. And if your baby is warm enough, you certainly can go out for a walk, because actually fresh air is good for the baby. It's good for the baby to get out, but it's also good for the mother to get out without the baby. And I know it's really, really hard to leave your baby at home with somebody else, even with your partner. What I suggest is you walk around the block, or you just go out, you walk up and down the sidewalk a couple of times and go back in again. And then the next day you go a bit further. And I get that. It was really hard. The first time I left my baby, I still wonder how I did it. And that, again, it was a full-term baby. So some of it's normal. But if you can't go to the next step, then you really need to talk about it. Or see
absolutely. Because we have to be well to take care of our babies. And, and always the analogy, put on a plane, put the oxygen mask on yourself first, right? And then you support your child or somebody that is traveling with you. And I always love that, because I feel that the parent or the main caregiver for the baby, we really forget about ourselves, especially during that first year at home. It's so hard to just focus on the baby. A lot of us are in survival mode for that first year, trying to keep the house up and running, deal with other kids, deal with the extended family. It's very hard. And most of us mothers and the primary caregivers, I think we always struggle to realize how, okay, we got to take care of ourselves first, so then you can take a better care of our children. And we have work to do on ourselves, but we also have peer support groups here at CPBF every Thursday. We have a virtual peer support group, and it's a drop-in group that people can just come and talk and share those experiences, share the anxiety, especially now coming the holidays for so many people around Canada and worldwide. There's Christmas, there's Hanukkah, there's so many celebrations that families will be together and expect us to come and bring the babies to this, maybe the first family gathering with the baby, and the families are really anxious about it. So that's why you mentioned about the letter. I love the letter that we have here at the foundation, because the letter, it's us giving to your family, your extended family. So the onus is not on you to tell your mother-in-law or your sister-in-law that, I don't want you to hold my baby, but it's really a letter from our organization, written by Marianne, healthcare provider, on how to, why your baby is more vulnerable, why we should not be passing the baby around. As Marianne said, to have one designated person to hold the baby if you have to go to these gatherings, to really try to decrease the risk of your baby getting sick, because it's not good to be readmitted in hospital. So many of us have been there, and the trauma is real when you're back into the hospital with your baby, sometimes back on a CPAP, or having a hard time breathing again. Is triggering and bring us so many memories that from the NICU time that it's very hard for many of us. I can certainly say for myself, that was very hard for me. We spent the first Christmas in the ICU at the kids hospital after being the NICU for 5 months. So it was hard. And 12 years later, I still have PTSD of that that first holiday with my son at home. So yes, I think we have to, right, Marianne, have to take care of ourselves. And now, sorry.
I have a question for you, because families can't do anything about having siblings at home or in daycare. Okay. They can't do anything about it. It is what it is. And it's important for the siblings to go to daycare or to have a normal life, or whatever it was, the life they had before. A lot of times parents feel guilty because their baby gets sick, because presumably from the sibling going to daycare. There is very little you can do about it. Even babies born, second child being born full term, those second children, those third children are going to get sick. There's very little you can do about it other than remembering about the hand washing. I really believe that that is the best you can do, and to try and keep the young children away from touching the baby or kissing the baby, etc. But I want to ask you, did you feel guilty when Gabe got sick?
Yes, absolutely. Even though I knew there was nothing that I could do to prevent it, because yes, my older son needs to go to daycare because I didn't want to interrupt his routine. I also didn't, I still want him to have fun with his friends in daycare, but I need time alone with the baby at home. So it was, okay, I have at least 6 hours of the day where my oldest child is on the daycare, so I can focus on this baby. But for sure, I felt guilty. And I felt even worse when I was away at Christmas, because Christmas is important for our family. And I was in the ICU with the baby, and I was not with my older son. So I felt extremely guilty. So I had to work through my mom's guilt on that for sure. And, but I have a friend who is a psychologist, and she always said to me, this is one season. Okay. And you have your child for your children for the rest of your lives. This is one season in their lives, in the life of the older siblings she was referring to. And that gave me great comfort that, yes, this is not a permanent life. Yes, we're still going to have fun as a family all together. It was one season, and that's what it was. Right. We had a lot of time to make up for the 5 months I was in the NICU with my baby. And we were complete as a family as it was after the NICU discharge. And as much as we could, we tried to bring Thomas, my older son, into the NICU. We were part of the family integrated care. So we had Sundays together as a family. But it is hard. It is. Today, there was a message in our private group from a mom who is an hour and a half away from home, 2 other kids at home, and a baby's in the ICU. It's hard. Okay. We all feel for those parents, because we want to be a complete family. Nobody planned to be in the ICU, and it happens. And yes, we have the guilt for sure. But that's why we also offer peer support, because this is something that we all feel as parents, right? Like how do we divide ourselves into many parents to be with all the kids at the same time? It's not possible, right? So we have to make some difficult choices and try to find, I don't like the word balance, because I don't think there is such a thing, but try to find somewhat of a balance and be kind to yourself. I think we are so hard to ourselves as parents, and just be kind to us, because we're also learning as we go. There's no manual to parent a child.
No, there are no manuals. But I agree with you, but everybody feels guilt if the child gets sick or the other children don't get what they should get. I mean, that is just what we all get as parents. We all end up in that same kind of boat. But I do want moms or the parent who's ever responsible for the baby, be good to yourself, but be good to yourself by, when you have a chance, get into the shower, comb your hair, wash your face, just do those 3 things. And that's extremely important to look after yourself. The other thing is, don't worry about dust, because dust will always be there. And if you don't do it today, you'll do it next week, because it won't go away. So what I'm trying to say is, do what you have to do. And I really want you to try and have a little bit of fun with your babies, and not feel and not feel guilty about it, although we do feel guilt. Here's a question.
It's a comment, actually. So that's a comforting line. That is the only one season my boy spent 89 days in the ICU. But you're right, you have lots of time to catch up. Absolutely, Romeo. Be kind to yourself, because it's true. We do have a lot of time. We have a life ahead of us, right? This is just one period of the time in our lives. And as long as it seems and it feels long, my son was 446 days in the NICU. It is for us it was 2.5 seasons, but it was, it's behind. Like, we have to learn how to deal with the trauma later, but we have a lifetime ahead of us. But Marianne, before we wrap up, I want to bring up 2 things. One, you mentioned that we have our infographic in 19 languages. So for all the healthcare providers watching us today, yes, the RSV, it is in 19 languages, the most spoken languages in ICUs across Canada. And also we have a partnership now with Our Kids Health that I'm going to share here, the website and so let me put the website first. So Our Kids Health has culturally adapted materials to 10 different communities, including some indigenous communities. And it's very important because those materials are in their own languages, and the information is delivered by healthcare professionals from those communities. So it's great work done in collaboration with Kids Health Network, and you can find them on all social media with the hashtag OKH Preemie Hub. There's a lot of information about immunizations, about RSV and how to protect your baby, but also the developmental milestones for the babies after they go home. So there's a lot of good information if you are healthcare providers watching us here today in 10 different languages for 10 different communities. And then back to the RSV conversation and the protection. We do have the criteria for palivizumab in every province in Canada, and Ontario, Quebec, and Nunavut have the new injection nirsevimab. The information is also on our website. It's very important to know the options. There are options available, and ask your doctor if you're in Ontario and Quebec about this option for every baby who was born in 2024 in those provinces. So Marianne, any final thoughts before we wrap up?
No, I think what you said about the parents putting their mask on before they, go help anybody else in a plane, I think that's a really important sentence. That's number one. Number two, I wish that I hope you to have a lot of fun. And throughout the holiday season, I hope you have a lot of fun as well, because it is important. But if you find it stressful, I think it's really important to be honest with families and find that letter on CPBF, because then it's not you. It's a letter that's come from healthcare professionals. It's not you making something up to stay away from events, if you understand what I'm saying. So that will help you to say, you know what, this was given to me when I left the NICU, or however you want to do that. But remember, it's decreasing the risk. And remember that it's hand washing and lots of loving.
Absolutely.
That goes hand in hand with hand washing.
Anyway, Marianne, thank you so much for joining us here today, for sharing your expertise, your insight, your years and years of experience, work with families like mine and so many families in this live session today. We are very grateful to be working with you, and we wish you a wonderful holiday. And I hope you are one of the designated persons on your daughter's list when you have your family gathering this season.
I am one of her designated people. And it's interesting because the event we went to on Sunday, people don't understand that. Even with a full-term baby, that baby is only 4 months old. And if you remember the graph and the absorption of the maternal antibodies, 3, 4, 5 months, this baby's at risk. The baby did have his RSV injection because he was born in Ontario. But I still feel it's important to remember to decrease the risk, however, because you don't want to feel guilty that your baby got a cold if you can help that.
Absolutely.
So thank you for asking me, and happy holidays, everybody. And if there are any further questions, you can go through Fabiana and CPBS.
Thank you, Marianne.
Thank you.
And to all of you watching us live today, thank you for joining us. And a special thanks to our sponsors, AstraZeneca and Sanofi, who makes education sessions like this one possible. And just a reminder that if you missed part of today's session, head over to CanadianPreemies.org to see this episode and all past editions of Preemie Chats. We will find many resources and support options available there. And we also be reminded that CPBF is a charitable organization and depends on support to continue its important work. Consider how you can support CPBF in its mission to empower families of premature babies in every step of their journey. Together, we can create a brighter future for all preemies and their families. And we'll see you again this Friday at 1 p.m. Eastern Time is our last Preemie Chat of 2024. We're going to talk about the need of babies being intubated. Is it still a reality? So tune in at Friday, 1 p.m. Eastern Time. Stay well, everyone. Thank you.